Morning everyone, going to be doing the PAT assessment on our patient here who's a little bit noisy, I'm afraid. So our PAT assessment, a brief overall description of it is basically a windscreen survey like we did in CLS 105, is basically how we look at the patient before we actually touch a patient, what our general impression of them is. And the PAT triangle just helps us look into certain areas that are going to help us assess whether we need to rapid transport this patient or whether we can take our time at the client's home. So to begin with, we've got our PPE on, we've walked into scene is safe, done our reports. This is basically when we walk in, what we're going to see and what we're going to do before we actually physically touch the patient. So on the assessment triangle, appearance, work of breathing, and circulation, sorry. So to begin with, we're going to look at the appearance of the patient. So general appearance we're looking at, then we're going to go into, in particular, the tickles mnemonic. So we're going to look at their tone, whether they're sort of lifeless and flimsy and sort of not really able to get anything out of them really. Then we're going to look at their interactiveness, seeing whether they're watching any of the toys that they've got around them, whether they're watching us walk back and forth looking at the parents, whether they're actually interactive with what's going on around them. Then we're going to look at their consolability, so if they're crying, whether there's a way to stop them crying, whether it's the mum patting them or just sort of trying to get their attention, whether they're actually consolable or whether the pain's just always there. Tickles, then we're going to look for their look and their gaze. So it's basically like looking in their eyes, whether they're looking straight past us and they're not actually with us at the time, whether they're sort of just out of it. Whether they've got a gaze over their eyes, whether they're really glassy, those sorts of things is what we look for gaze. And then for speech and cry, so whether the actual, like depending if it's a baby or an actual child, whether their cry or speech is really like horsey, indicating some sort of respiratory issue, whether it's real, whether it's like an actual painful cry or anything along those lines, horsey or sort of stridor sort of sounding like that. So that's for the appearance side of the triangle. Then we move on to the work of breathing, which we actually look at the patient more closely really. So usually they'll have the clothes off, obviously, if they've called the ambulance for some distress. So you look, starting from the face, you look to see where they've got their nasal flarings. I don't know if I can do it properly, but the nasal flarings of the trying to get some extra air in. Then you look for the tracheal, like at the neck, seeing whether there's any extra muscles being used there, and then particularly at the collarbones, whether they're using their shoulders to get more breath in like this. It's a bit hard to show on my little patient here. So you look along the collarbones. Then you look at their bellies to see whether they're using their bellies to get extra air in, whether they've got sort of like how they're sort of sitting to try and get their work of breathing in if it's sort of an issue like that. Basically just the positioning of the child as well. So whether they're sort of hunched over, whether they're leaning back on their backs, and just looking at how they're actually breathing in, seeing if there's any issues there. So that's the second side of our triangle. And then we look at the circulation, which is, as it sounds, we're looking to see whether that if there is getting in, whether it's circulating properly, which means if they're getting any of the oxygen in their blood and around to their organs. So you can see in their toes whether their toes are a bit blue or a bit cold. You're looking around their mouth, see whether it's cyanotic, whether they're pale, the colour of their skin. All these things you can ask the patient's parents as well. Ask them whether they usually look like this, whether they usually have, a different coloured lips, or whether their eyes are a bit more whiter than they should be, pink in those sorts of areas. And those sorts of things as well. Like I said, it's a bit hard to see in our patient here, but they're the sort of things that we're looking for. And then I have a diagram here as well. So based on the triangle, if all sides of the triangle seem to appear normal, obviously they probably wouldn't call the ambulance in that case, but if they do and you've got one side, it sort of indicates whether it's shock, whether it's respiratory distress, if it's just on the work of breathing side. If it's on the work of breathing side and appearance, we're looking at respiratory failure, and then so based on how much they indicate on one side of the triangle, on this side of the triangle, based on that, if any of them are sort of indicated, that sort of means that we do need to sort of take them to hospital. That's basically our assessment. So based on that, after we do that, then we go on to our particular bodily function. So you do the respiratory assessment, neurological assessment, all those types of actual particular parts of the assessment once we know which one sort of needs more attention. And that's it. Thank you.